So first you start off with hand hygiene. Okay, and make sure you get all surfaces like with hand washing. And then if indicated, you put on some PPE. We can assume that it's indicated in the situation. Okay, and then next we put on our mask. Alright, and then we'll put our sterile gloves on in a moment. But first you have to go make sure that the patient knows what's happening, so explain to them what's going on. And then check the expiration date of your gloves to make sure they're still good, and make sure the surface is dry as well as the package. Then you can go ahead and put them on. So you open like this. You can only touch about 2 inches on the sterile surface. Then you take your non-dominant hand and glove up with your dominant hand. Make sure you're not touching anything sterile right there. Pull them down as best you can, but don't touch that sterile surface. And then you're going to take this glove like such, put it on. Again, don't touch the sterile surface. If you need to move the glove down, make sure you touch sterile with sterile. And you can move it like that. And then you can go ahead and take your PPE off after you're done with the procedure with your patient. So we can start by doing this. So in order to take these gloves off, it's like you take normal gloves off. So you can touch the sterile part now because it's probably contaminated. So go ahead and do that. Keep it in the palm of your other hand here and slip it off like you would do normal gloves. Alright, and then you can go ahead and take your PPE off. So we undid that, gloves, then we'll do goggles. Take off the rest of our gown. And face mask. Alright, and then just make sure you discard this appropriately as well as discarding your gloves appropriately. You can go ahead and touch the sterile portion here, pick it up like this, and put it into whatever you need to discard it in. And that's all.